Hey, what's up? My name is Dr. Brad Stewart. I'm the owner of Clear Life Hearing Care in Dallas, Texas, and today we are going to be talking about how to maintain, use, and take care of your hearing aids. Stay tuned. Whether you just started wearing hearing aids and you're not really sure how to clean, take care of, maintain, and use your hearing aids, or if you're a long-term user and you want to get some specific questions answered, I'm going to be looking at some popular hearing aid brands and exactly what you need to know to use those devices, take care of them, keep them maintained, and working optimally for the long term. Okay, so I have in front of me some of the most popular hearing aids in the market right now. We've got the Oticon More, the Phonak Paradise, and the Signia Pure Charge and Go. We also have an older Oticon battery powered product to show you battery versus rechargeable. So the first thing that I like to do is just kind of go over the anatomy of the device itself. So this is your hearing aid. This portion is the actual hearing aid body. So inside this we've got our computer chip. We also have microphones. And then depending on the product, you might also have push buttons on the back of the device here. Then you also have the wire, and this, for receiver in the canal hearing aids, this wire is actually truly a wire. And then the speaker that sits down inside the ear canal. At the end of the earpiece is this dome-shaped object, which we call a dome, which that can be removed and replaced. And then we also have a retention wire, which you might or might not have a retention wire. It's just there to keep the hearing aid in place inside of your ear. Okay. So generally speaking, when we talk about batteries, most devices today, receiver and the canal devices, have rechargeable options. So you'll see where these devices sit down in some version of a charger. And essentially the way all these products work is you wear the device all day, and then when you go to take the hearing aid out of your ear at night, you just put it in the charger. The device will charge up overnight, and then in the morning when you take it back out of the charger, it will automatically boot back up. These are designed to be safe for lithium-ion batteries so they won't overcharge, and generally it's okay just to store them at night in the charger. I would recommend that you not store them in the bathroom just because of the humidity, although most products these days are getting pretty good at moisture resistance. Another style, which is also still out there and still fairly popular, is a disposable battery powered hearing aid. So you can see with this particular hearing aid, the battery door is on the bottom of the device. So with these, when you take them out at night, you just want to crack the battery door open. That's going to turn the device off, and then in the morning when you put it back on, you're going to shut the battery and that will boot it back up. Batteries on these devices can last anywhere from 3 to 10 days depending on the type of hearing aid, your hearing loss, the size of battery, and other factors. These batteries will typically come in a case like this, and you will actually take one of the batteries out of the case. You'll peel the sticker off the back of the battery, which these batteries are air activated, so that starts the activation process. I recommend letting that battery sit out for about a minute to 2 minutes before you put the battery inside of your device to make sure that it's fully charged up. Okay, now let's talk about actually cleaning and maintaining your devices. The good thing about hearing aids today is most of them are fairly low maintenance. So there's not too much that you really need to do with your hearing aids on a daily basis to keep them cleaned. The main thing that I recommend is just have a cloth or a tissue. You don't need to use cleaning solution, although there is hearing aid specific cleaning spray which you can use. So if you use something like that, you don't want to spray it on the hearing aid itself. You want to spray it on a cloth and then use that cloth to wipe off the earpiece, or you can just use a dry cloth. You don't have to use cleaning solution, and really I generally don't recommend most people use cleaning solution unless you have really waxy ears and they get really dirty. But generally you're just wiping any debris off of the earpiece at night after you take them out of your ears, just to make sure that they're staying nice and clean and well maintained. The next thing that I recommend as it relates to maintenance is routinely replacing your domes. So your domes over time will become discolored, though the little grommet that the domes attach to the speaker will get loose and the dome can get stuck in your ear. So I recommend replacing that dome every 3 months or so. You should have a pack of domes that came with your hearing aids, or if they didn't, you can go ahead and purchase a new pack of domes. But those domes, and again, they vary by manufacturer. I'm looking at the Oticon domes right now, but they're fairly simple to put on. I don't know if you can see, but there's a little grommet down inside. The trick that I use is just to kind of get it lined up with the grommet and then rock that speaker into place with the end of my finger. I see some people trying to kind of manually push it on there, and it's kind of hard to do. So I recommend using the end of your finger and just rocking it onto the end of the receiver. So to take that off, underneath is a wax filter. And you're going to see with most receiver in the ear hearing aids, there's going to be a wax filter. The tools that they use to replace the wax filter will vary between manufacturers, but the concept is the same. So the purpose of a wax filter or a wax guard is to keep earwax from getting down inside of the hearing aid, which can stop up the speaker and cause sound to stop coming out of the hearing aid. So replacing your wax guard is actually the #1 recommended troubleshooting tactic if your device ever stops working. So if you're ever not hearing out of your hearing aid, the first thing we recommend is to replace the wax guard. The way that you're going to do that is you're going to take the manufacturer's wax guard tool. You're going to pull one of them out in this case, and you can see with the Oticon wax guards, this is a removal tool, and that's a replacement wax guard. So we're going to stick the removal tool straight into the receiver opening of the hearing aid, pull the old one out, and put a replacement in. So that's fairly straightforward. And then this guy is trash, those are disposable. Of course, after you do that, you do want to put the dome back on. Phonak has a little bit different system, which I'm not a huge fan of. They've got this wheel, so you have a little trash can on one and then a replacement wax guard on the other. So you stick the hearing aid into the trash can end, pull out the old one, and snap in the new one. And what can happen with the new one is it can get stuck and kind of wedged in funny, and then your speaker now has a filter wedged into it crooked. So you want to make sure you put straight in, straight out with the Phonak. And then of course we're going to put our dome back on. And then it's a similar kind of process for the Signia hearing aid. The only difference, as I throw the dome across the room, I do notice that Phonak with their new receivers and their new domes, they're kind of tricky to put on, but once they're on, they stay on, so that's good news. It's the same concept with Signia, and Signia's domes, if you get an actual Signia dome, can be pretty tricky to get on and off because they really kind of snap on, and so you have to roll them back off. But it's the same concept, just with the Signia, they have sticks, and so that's the removal end, and that's the replacement wax guard. But again, wax guards are your #1 troubleshooting tactic. Okay, and then generally speaking, a couple of other issues that can come up. You can get debris stuck inside the microphones. So if you start to notice that devices sound weak, you want to point the microphone down, and you want to brush along the microphone with the microphone facing down. That way any debris won't fall deeper into the body of the hearing aid. Instead, it will just fall out of the bottom of the hearing aid. You would be surprised how big of a difference it makes having clean microphone ports. And again, The mic ports vary in where they're located on different devices. So like that's your Phonak front microphone and back microphone. This is your Signia front microphone, back microphone. So they look a little bit different, but they all have a fairly similar arrangement. Okay, and that's, as far as regular daily maintenance, that's basically what you need to know. You do need to make sure that you try to keep the devices dry. They are water resistant, but they're not waterproof. So you want to avoid taking them in the shower or going swimming with them. If it happens, generally you're okay. Generally you can, throw them in your dryer jar or in a bag of rice and pull the moisture out, and generally that'll be all right. Okay, the final thing to look at now is how to put hearing aids in your ears. Okay, so generally putting hearing aids in your ears is a 3-step process. So with this receiver in the canal style, we're going to put the behind the ear portion behind my ear first. We're going to put the wire down in front of my ear, push the speaker and the dome down inside my ear, and then flip the little retention wire into place. So here's how we do it. First, we're going to go behind the ear with the hearing aid. Then we're going to put this speaker down inside my ear. Make sure that wire is going right over the top of the ear, and then just flip the retention wire down into that cavity, and all that device and everything should just kind of disappear back behind your ear and should just sit nicely in place. So it should just stay on your ear. If you notice hearing aids are falling out, if you notice you're getting feedback, things like that, it's probably because it's not fitting in your ear properly, which could be to do with how your audiologist originally set up the hearing aid, and it could have to do with the actual shape and anatomy of your ear canal. So you want to go to your audiologist and talk to them about why the hearing aid is not fitting in your ear properly, because it's typically something that can be resolved. But if it's not resolved, it will have a negative impact on your outcomes with your hearing aids. You won't like the way they sound, they're less comfortable to wear because they're falling off all the time. So you want to get it resolved. But that should do it. Just flip it behind the ear, push the speaker inside the ear, flip up the little wire, you're good to go. Even if that falls off of my ear, it's still going to stay in place. It's not going to fall out of my ear. All right, I hope this was helpful. If you enjoyed this video, make sure to like and subscribe to the channel for more content related to hearing, tinnitus, and technology. Talk to you in the next one.